Question number 1. Which of the following best defines community diagnosis? The correct answer is C. Identifying health problems in a community. Question number 2. The father of public health is considered to be. The correct answer is C. Hippocrates. Question number 3. The health worker's primary role in the community is to. The correct answer is C. Provide preventive, promotive, and basic curative care. Question number 4. One community health center is established for every. The correct answer is C. 80,000 to 1.2 lakh population. Question number 5. Which of the following is an example of primordial prevention? The correct answer is A. Health education to prevent diabetes. Question number 6. Rural Health Mission in India was launched in the year. The correct answer is C. 2005. Question number 7. ASHA worker is a link between. The correct answer is B. Community and healthcare system. Question number 8. Which of the following is not a function of PHC? The correct answer is B. Minor surgeries. Question number 9. Which vaccine is given in 0.1 milliliter intradermally? The correct answer is C. BCG. Question number 10. ASHA stands for. The correct answer is A. Accredited Social Health Activist. Question number 11. The ideal site for BCG injection in infants is. The correct answer is B. Lip deltoid. Question number 12. Which of the following diseases is included under NLEV? The correct answer is B. Leprosy. Question number 13. The expanded program of immunization was initiated in India in. The correct answer is B. 1978. Question number 14. Janani Suraksha Yojana is aimed at. The correct answer is C. Promoting institutional deliveries. Question number 15. The first line of treatment in diarrhea is. The correct answer is C. ORS. Question number 16. The main vector of filariasis is. The correct answer is C. Culex mosquito. Question number 17. The cold chain is maintained to. The correct answer is C. Maintain vaccine potency. Question number 18. The leading cause of maternal mortality in India is. The correct answer is C, hemorrhage. Question number 19. Which of the following is not a live vaccine? The correct answer is D, TT. Question number 20. Integrated Disease Surveillance Program was launched in. The correct answer is C, 2004. Question number 21. Health education is an example of. The correct answer is A, primary prevention. Question number 22. Anganwadi workers are part of which program? The correct answer is B, ICDS. Question number 23. Which disease is transmitted by contaminated milk? The correct answer is B, brucellosis. Question number 24. IMNCI strategy was introduced by. The correct answer is D, WHO and UNICEF. Question number 25. The full form of UIP is. The correct answer is A, Universal Immunization Project. Question number 26. Revised National Tuberculosis Control Program uses which strategy? The correct answer is B, DOTS. Question number 27. Which level of healthcare is mostly preventive in nature? The correct answer is A, primary. Question number 28. The main aim of family planning is. The correct answer is C, controlling population growth. Question number 29. The normal birth weight of a newborn is. The correct answer is C, 2.5 up to 3.5 kg. Question number 30. Which of the following is a behavioral disease? The correct answer is D, tobacco addiction. Question number 31. In malnutrition, marasmus is caused due to deficiency of. The correct answer is C, both protein and calories. Question number 32. Which method is most effective for birth spacing? The correct answer is B, Cafferty. Question number 33. The most important approach in community health nursing is. The correct answer is C, family center. Question number 34. Which of the following is an occupational disease? The correct answer is C, silicosis. Question number 35. The term Health for All by 2000 AD was given by. The correct answer is B, WHO. Question number 36. Which vitamin deficiency causes scurvy? The correct answer is C, C. Question number 37. The role of A&M includes. The correct answer is C. Home deliveries and immunization. Question number 38. Which of the following is used for chlorination of water? The correct answer is C. Bleaching powder. Question number 39. Exclusive breastfeeding is recommended for how many months? The correct answer is C. 6 months. Question number 40. Measles vaccine is given at what age? The correct answer is C. 9 months. Question number 41. Disease eradicated from India is. The correct answer is C. Smallpox. Question number 42. Census in India is conducted every. The correct answer is B. 10 years. Question number 43. How many health workers are there per subcenter? The correct answer is C. 2. One male, one female. Question number 44. One A&M is allotted for a population of. The correct answer is C. 5,000. Question number 45. Typhoid is prevented by. The correct answer is C. Typhoid vaccine. Question number 46. What is the full form of MTP? The correct answer is C. Medical termination of pregnancy. Question number 47. DOTS treatment is given under supervision of. The correct answer is D. Any trained provider. Question number 48. In which year was the Alma Ata Declaration made? The correct answer is C. 1978. Question number 49. Which level of prevention focuses on disability limitation? The correct answer is C. Tertiary. Question number 50. The mission of National Health Policy is to achieve health for all by. The correct answer is D. 2030.